All right. Hi, everyone. Welcome in. Welcome in. Today's presentation is going to be about pediatric oncology, specifically pediatric leukemia. And so I'm Ronesia Williams. You can go to the next slide.
Okay.
But I'm Ronesia Williams. I just received my bachelor's degree from the University of North Florida in nutrition and dietetics. And currently, I'm a dietetic intern at Texas State University pursuing my master's degree.
And I'm Travis Luzania. I have my undergraduate degree in nutrition and dietetics from Texas State University, where I am also currently enrolled in my master's for human nutrition and am also a dietetic intern.
All right, and so this presentation is really geared towards parents and caregivers to give you all a better understanding of your child's diagnosis and what it means, the role that you play in helping your child cope with treatments, and also how you can improve the outcomes of their treatments through nutrition. And so some of the three main topics that we'll be discussing today is what is pediatric leukemia, types of pediatric leukemia, as well as how childhood leukemia affects their nutrition. All right, so our overall objective is to inform parents and caregivers on the foundation of what pediatric leukemia is and how you can support your child diagnosed with pediatric leukemia. And so we have three main learning outcomes. So the first learning outcome is we want you to be able to identify the most common type of childhood leukemia. The second outcome we want you to be able to find is to identify two symptoms of receiving treatment of childhood leukemia. And then lastly, we want you to be able to identify two methods to managing nausea symptoms. All right, and then here we have a list of resources, which you'll be going home with some handouts today. Um, and some of it is things that you can hang up around the house, maybe on the fridge, so that way you can keep a basis of what it is. And then also, having nutrition facts that are quick and easy for you to see if you're preparing meals, and also to have access to recipes that you can provide for your child and your family. And so to get started, we're going to start at the basics. What is pediatric leukemia? All right, so pediatric leukemia is cancer of the blood found in younger children. And so to start off, leukemia is basically it's defined as the overproduction of abnormal cells that cause crowding within the bone marrow, so it pushes out nutrients and also doesn't leave enough room for space. And so this can occur in ages two through four in children, but it can also be seen in teenagers, the older that they get. And so um, the development of childhood leukemia has little information on what causes it. It's not been linked to nutrition status, environmental factors, or genetic factors. And so there are certain medical aspects that can increase a child's likelihood to developing leukemia, such as already having a different form of cancer and receiving radiation and chemotherapy treatments, or having a genetic condition such as Down syndrome. And then they can also have an inherited immune system problem that can make them more susceptible to, having childhood leukemia. And so some of the signs, I think you go to the next slide. Yeah. So some of the signs and symptoms of leukemia involve anemia, bruising, bleeding, joint pain, as well as bone pain. They may be shown to have swollen lymph nodes, reoccurrent affections, maybe abdominal pain, and different things like that. And so some of the signs and symptoms, though, that are correlated with leukemia start as being seen due to something else. Um, and so, many times the signs and symptoms can also resemble alternative blood disorders. And therefore, when you take your child to their doctor, they have to do they have to intently look at a child's health, and then the signs and symptoms to determine whether it's leukemia or a different blood disorder. And so I did want to mention that leukemia cannot be prevented in children. And so I think many times, as parents, we try to think of what we could have done differently, what we could have changed to prevent the child from getting certain diseases. But for leukemia, there aren't any known preventative measures to avoid. And so most children living with leukemia also have no prominent risk factors aside from having either a genetic or immune disorder. And so you can go to the next slide. Oh, wait, go back really quick. I wanted to mention really quick when it comes to treatment of leukemia. So, treating childhood leukemia is normally done with either radiation, chemotherapy, immunotherapy, drug therapy, or stem cell transplants. And so, each treatment option is based off the severity of leukemia in the child, as well as what type of leukemia the child has, which Travis is now going to go into.
Okay. So the key distinction in identifying the type of leukemia your child has is going to first depend on, is it acute or is it chronic? Acute refers to a fast growing leukemia, whereas chronic refers to a slow growing one. The second important distinction is whether it's affecting lymphoid cells or myeloid cells. The lymphoid cells are lymphocyte forming cells. B and T cells, which are immune cells, are the ones that are affected in this case. And then myeloids are cells that form white blood cells, such as neutrophils or macrophages, cells that form red blood cells, and cells that form platelets. So now that we've made that distinction, uh, the most common type of leukemia in children is going to be acute lymphoblastic leukemia, or ALL. That's most common in childhood, typically between the ages of 2 and 4. And it's most likely going to be affecting B cells in younger children. And in older children, it's more likely to affect the T cells. With acute myeloid leukemia, that's going to be the second most common type. This one is going to start development in immature bone marrow cells, or those myeloids. And it's most likely either before the age of 2 or when they're a teenager going through adolescence. And then the next one is going to be chronic myeloid leukemia. This one is going to be uncommon, and it's actually broken into 3 different phases. The first phase is the chronic phase, and in this phase, their symptoms are pretty mild and it responds really well to treatment. Uh, it's typically the phase at which it's diagnosed, being that chronic phase. The second phase is going to be the accelerated phase. In this one, it's less responsive to treatment, and the child will start to develop more symptoms such as poor appetite or weight loss. And then in the third phase, it actually switches from chronic to acute. So it becomes more aggressive and fast growing. It can spread to other tissues and organs. And again, you're going to see poor appetite and weight loss. Oh, sorry, I missed one more. Chronic lymphocyte leukemia is the fourth and final one we're covering. And that one is actually very rare. So you're most likely not going to see this type, but symptoms common with it are going to be appetite loss, weight loss, and fatigue.
Okay. And so now we're going to go into how pediatric leukemia affects the effects it has on nutrition. And so when it comes to nutrition in children who are receiving treatment for pediatric leukemia, they usually receive treatment from leukemia via chemotherapy or medications. And so each one of these has different effects on the child. For instance, chemotherapy can tend to cause the child to lose weight. And so they need to consume high calorie, high protein foods, versus where some children are put on medications such as steroids. And so those can actually have the opposite effect and cause the child to gain weight from that medicine. And so having the correct nourishment aids in the child being able to handle those treatments better, as well as decreasing the extent of the side effects and the magnitude that they have on the child. And so nausea and vomiting are two prominent components that can affect your child's intake. And so At home, you can help your child eat healthy by working to make, a creative environment that is enjoyable and rewarding for them to eat. And so there's a possibility that meal times can become stressful for the parent. And so working with your child's care team can help you better manage this. And so in addition to this, and making sure that you include in their diet those high calorie, high protein foods are, very important, as well as hydration. So, because children may sometimes experience vomiting, with vomiting and nausea, that comes dehydration, excuse me, um, where you need to pay attention to the child's intake of fluids, and also with nausea. Sometimes the kids don't want to eat, they don't want to drink anything, they don't want to eat anything, and so that can also have an effect on how hydrated the child is. Um, and so they can have, extreme losses of fluid due to the vomiting and diarrhea and, overall not wanting to eat. And so you can go to the next one. And so on this slide, I found a website. Um, it's called Cook for Your Life. And so they have chemo safe and kid friendly recipes. They had what was it? A pizza, what was it, a kale pizza recipe I think they had, and then they also had like a vegetarian style cheesy cauliflower macaroni that they had on there. And so this website helps parents. Maybe you have a large family or you have other kids you have to take care of. So you can go on here and find recipes that are quick and easy, already done for you, that you can go ahead and prepare for your child dealing with leukemia. There you go.
Okay. And as she was saying, some of the most common symptoms that children are going to have during leukemia treatment, it's going to vary by the treatment, but the most common are going to be nausea, vomiting, dehydration, and appetite loss. And these are all going to pose special challenges, making sure they get their proper nutrition while they're undergoing treatment. Um, so one thing that will help is if you keep a food and fluid diary, and that can help prevent a lot of those symptoms as you're monitoring what your child is consuming and what's going out of them, like their urine, so that you can kind of keep track and making sure they're getting adequate amounts of fluid. So for nausea, some recommendations to try to alleviate some of those symptoms. You can try providing frequent small snacks. If they develop an aversion to certain protein sources like red meat, you can try different protein sources, something a little more bland, such as chicken or turkey. If you give them a steady intake of liquids throughout the day, that will help kind of keep them from getting too much on their stomach at one time. You can also again, offer bland foods, or you can serve food cold, and that'll help lower the smell and taste. You especially are going to want to avoid serving any kind of fried food, fatty food, spicy, or sweet foods. For vomiting, you're going to want to reduce smells and odors coming from the food and from the kitchen during food preparation. You also want to provide a steady intake of liquids to sip on, especially because dehydration is going to be an issue there. And if they're getting bitterness from metal, such as forks and spoons, you can try giving them plasticware to eat their food with, and that should help with that bitter taste there. For dehydration, you're going to want to provide cold, cool liquids. It's a little easier on the stomach, and it can also help keep them well hydrated. You're going to want to provide multiple small meals, giving snacks that are high in water content, such as soup and smoothies. And then again, track the fluids that are going in and out. And then finally, with appetite loss, you're going to want to provide smaller meals throughout the day, kind of similar to the other ones. You can try giving breads and pastas with protein sources like chicken, eggs, or beans. And if the child is bothered by smells, stick with those bland foods. Otherwise, you can go ahead and get something that has a pleasant smell that they are fond of and try to kind of appeal to that sense of appetite. And then also present them with liquid food options anytime they're not in the mood to eat, so you can kind of help still get some calories and nutrition into them during the day. And we also include a link here as well to the cancer.org's website, and they cover a lot of other symptoms that we didn't cover today. So, to recap, we covered what pediatric leukemia is, the primary types of leukemia, the role that nutrition plays in improving outcomes, and ways to manage common symptoms your child may experience. You should now be able to identify the most common type of childhood leukemia. Should be able to identify two symptoms of receiving treatment for childhood leukemia and be able to identify two methods to managing nausea symptoms. This is just a list of our references we used in our presentation today if you want to check any of them out. We hope this presentation has condensed some of the information that you as a parent or caregiver want to know about your child's diagnosis. You play a vital role in the outcome of this diagnosis, and there are many things you can do to make this time easier for your child. If we can help answer any questions you may have in regard to this presentation, please feel free to contact us for more information. We thank you for your time today, and we wish your child a speedy recovery.
Have a wonderful day.